This is the epicenter of the COVID surge, Northeast Florida. Projections indicate over the next 2 weeks, things will only get worse. Right now, there is no sign the curve is going to flatten. Joining me on the morning show, Dr. Trishella Johnson-Foy with Baptist Health. Good morning.
Good morning.
The lines at testing sites are getting longer. The lines at vaccination sites, not so much. Even the heightened pandemic, new horror stories from the ICU, from the unvaccinated saying, I wish I'd gotten the shot, not changing minds. What's it going to take?
Well, I am not sure what it's going to take, but I'm hoping people are looking at the things going on around them, where they're seeing their loved ones getting more sick. They're seeing the young people that they thought couldn't get sick are now getting sick. You know, our ICU is overwhelmed. All of the hospitals are overwhelmed, and we're having a hard time keeping people around and healthy. So until we do something different about the vaccinations, the vaccination rates, this is going to continue.
So there's this more vulnerable group with the Delta variant, the younger generation. My friend, infectious disease specialist Dr. Mobeen Rathor, called teen vaccinations pathetically low. Are parents not getting the message? Does a political message, does misinformation outweigh medical science and the safety of their children?
Yes, I don't know that it's just the parents. I understand that there's fear about the vaccine, although they have gotten many other vaccines. So the hesitancy is understandable. A lot of people look at the fact that they think that it's not approved, but we've talked time and time again about the fact that this vaccine is very safe. You can look at who's being hospitalized and who's sick, and you know that the vaccine is working because the people that are hospitalized are people that are mostly unvaccinated. So I encourage parents, at this point, school is about to start. If there's not going to be mask mandates, you really need to make sure you protect your children. Because not only are they getting sick with just a little sniffles, there's an increase in hospitalizations now. We're really seeing this affect our children a lot more, and we have to protect them.
Well, you said it's not approved. It has emergency approval. So let me ask you about the side effects. There are side effects to all vaccines. MMR, diphtheria. Yeah, there are potential side effects, and the side effects are being studied. To the parents worried about those side effects, what do you say?
I would say that, again, there's always the potential for small things to happen. But when you look at the vast majority of any potential side effects from this particular vaccine, it's very minimal. The things that you have to worry about more are local reactions. Some people will feel that immune response and they may feel a little achy and feverish. That's treated with Tylenol. For any more serious concerns, even those things are self-limited, meaning they go away on their own. We're not seeing any major serious long-term effects from the vaccine. And so it makes it very safe as when they go get their measles and mumps vaccines and all of those things that are available now. So I would encourage them, this is deadly and that it's important to go ahead and protect our children.
So the recommendation now is that everyone, vaccinated or not, wear a mask indoors. Duval County's weighing a mask mandate in schools. Governor's fighting mandates every step of the way, says we should not, his words, muzzle our kids. If the kids are not masked, what may happen this fall?
If the children are not masked, we are going to see a grand increase in numbers. This surge is one thing, but once you start really putting them back into those hallways and those classrooms, you're not just the children you're worried about, it's the teachers, the parents of the teachers, the families of the teachers. It's going to spread throughout this community like wildfire, the way it is now when they're not huddled together in classrooms. So we have got to do better. We have got to make decisions that are not politically driven. We've got to do things that are really about protecting this community. And so if the leadership won't do it, the parents have to demand it. The schools have to demand it. We can't accept anything from what the government or what the leadership of our communities are doing. Some of them are very concerned, but they're getting resistance all along the way. So we've got to make sure that the fight is hard, that we make sure that we're protecting the schools and protecting our community.
I do know that Camden County in Southeast Georgia has a mask mandate. Dr. Diana Green held a workshop the other day. She says we can get an answer about Duval County and its plans going forward. Come Tuesday, we'll have that here on News4JAX. Dr. Foy, thanks for your time. Mel.